So for us to discuss trans health, we'll be tackling a case of a transgender woman who came in for due to nausea and dizziness. Okay? Babalikan natin yan later. Okay? When we tackle transgender health, we have to have a solid foundation of basic concepts or key concepts. Okay. For this session, I will not be tackling SOGSC because may separate session daw po kayo. Mas in-depth yung discussion for SOGSC. But it is very important for us providers to have knowledge or understanding of SOGSC and then the evolution of transgender health. How does one affirm their gender? And when we employ transgender health, we have to be trans-sensitive healthcare providers. So paano yun? We have to develop certain skills, competencies, no? Medical competency lang ba ito? Yan. And then I'll be tackling hormone therapy. Pahapyaw lang, no? At least. And then GAS or gender-affirming surgeries. And then yung ating pinaka-goal is to tackle yung mga cases natin na merong antiretroviral therapy habang sinasabay yung hormone therapy. Okay? So ngayon pa lang, kailangan natin magkasundo no, na ang gender at sex ay hindi na binary, meaning hindi na simpleng babae at lalaki. Dahil nga ang mga tao ay may diverse SOGSC. Kung nalilito pa tayo sa ating alphabet, SOGI alphabet, yung LGBTQIA+++, ang pinakasimpleng approach dito is simply it's the person's sexual or romantic attraction or pagkakagusto, yung kanyang self-identity, kung paano niya gustong ipahayag or expression at ano yung mga sexual characteristics na gusto niyang ma-develop para sa sarili. Okay? So this diagram basically summarizes yung SOGSC. You can actually scan the QR code para mas ma-access nyo rin to. No? This basically puts SOGSC on a spectrum na kung saan nasa magkabilang dulo yung alam nating babae and then nasa other end is yung lalaki. And bilang SOGSC can be very diverse, anyone can actually place or see themselves along that spectrum. Okay? So even for biological sex, no, hindi na simpleng male-female ito. We do have cases of intersex. So when it comes to transgender health, karamihan sa atin ngayon lang natin yata narinig ito, no? However, this has been siguro na-develop na siya as early as 1910. Okay? However, it was recognized initially in 1965 in a form of deviation or abnormality or something na hindi normal, no? So basically, all of these disease classification, yung ICD, even yung American Psychiatric Association, WHO, and the DSM, categorizes gender diversity or yung people with diverse SOGSC as a form of illness, as a form of pathology. However, dahil nga dito sa mga diagnostic criteria na ito, nilalagay natin na kapag may sakit yung isang tao, kailangan natin siyang gamutin. So, ang pagkakaroon ng kakaibang SOGI or yung hindi kagaya ng karamihan or ng normal, so ang pagiging transgender, pagiging bakla, pagkakagusto sa babae at lalaki, uri daw to ng isang sakit. Okay? So, medyo overarching yung diagnosis, no? So, parang yung treatment approach din, kailangan maibsan yung condition na yon, no? However, in 2018, WHO already declared that gender identity disorder is no longer considered as a mental illness and they shifted it under sexual health chapter. Yun nga lang, gender identity disorder pa rin siya. Okay? But may mga developments. So with the current ICD-11, this has redefined gender identity-related health. So instead of gender identity disorder, ginawa na siyang gender incongruence. Basic, ano na lang to definition, incongruence, meaning hindi nagtutugma yung kanyang self-perception of the identity at yung of their gender sa kanilang sexual characteristics or yung sa kanilang biological sex. Okay? Yan. So hopefully with this development or with this redefinition of the gender identity-related health, mag-i-improve din yung services or yung healthcare service or access ng ating mga people with diverse SOGI, not just for the transgenders. Okay? Yan. So with this, trans-related and gender diverse identities are no longer deemed conditions of mental ill health. Okay? This would ensure access to gender-affirming healthcare and health insurance coverage. Lalo na tong health insurance coverage, no? So magastos ang trans health, especially for the patient. But sa US, I am encountering clients na covered ng kanilang insurance, yung kanilang hormone therapy and lab test. Okay? And with this redefinition then, it acknowledges yung link between gender identity, sexual behavior, exposure to violence, and STIs. No? So ang gender at sex, lagi yung magkasama, no? Lagi yung magkadikit. So anything na sexual health-related, reproductive health-related, papasok lagi doon ang usaping gender. Okay? Okay. So basically, as early as 2010 pa, the World Professional Association for Transgender Health or yung WPATH has already been promoting na ang pagiging bakla, transgender, transsexual, gender nonconforming is not a pathology but a matter of diversity. Bakit kailangan nating i-emphasize ito, no? So this is basically depathologizing yung pagiging transgender or pagkakaroon ng diverse SOGSC. Okay? This is actually a path to trans justice, no? Pagkakaroon ng equal access to healthcare. Okay? Na trans people are no longer considered as having a disorder nor having their rights limited. At this, kung makikita rin natin na ang journey ng isang transgender person are unique individually. No? So hindi lahat ng transgender ay kailangan mag-hormones, hindi lahat ng transgender nag-undergo ng surgery. No? Hindi rin sila mababansagan transgender kapag nag-hormones lang sila or kapag nag-surgery. So yung pagiging transgender is a gender identity. Okay? So it is pathologizing actually to assume that a trans person's identity requires medical or even surgical, no, interventions. Yun nga. So I've mentioned na parang kikilalanin lang siyang trans kapag nakapag-undergo na ng mga medical interventions. No? So this is not exactly true. No? Hindi lahat ng transgender would require or would like to undergo such interventions. Okay? Yeah. So paano ba natin ma-depathologize? No? So a way to approach this is by employing yung informed consent. No? Ilalagay natin sa konteksto ng transgender health. Okay? So with informed consent, basically, nilalagay natin yung ating pasyente or ating kliyente sa center. No? Sino pa nga ba ang pinaka-expert sa kung anong dapat niyang matanggap na services or ano yung dapat niyang makuhang mga serbisyo? Di ba dapat yung individual? So kunyari, alam niya sa sarili niya may sakit siya, kailangan niyang treatment. So siya yung magde-decide para mag-access ng treatment. Gusto niya mag-develop ng certain procedures or gusto niya mag-acquire ng certain procedures, siya yung magde-decide for themselves. So with informed consent, basically, we acknowledge, no, and better support yung patient's right and capability in choosing care options. No? Hindi na nagre-require ng mental health professional if a person would like to pursue or to start on mga gender affirmation. Okay? Yeah. And this informed consent model would also enable us, yung tayo, providers, no, healthcare providers, to attain a richer understanding of transgender and gender nonconforming patients and to deliver better patient care in general. So actually, karamihan sa atin, no, nasanay kasi tayo with the gatekeeping approach na kung saan ang doktor ang magsasabi kung ano yung makakabuti sa pasyente. So for example, yung mga may medical clearance before siya mag-undergo ng certain procedure. So technically, yung pagbibigay ng mga ganong certain clearances, it's a form of a gatekeeping, no, minsan, no, at a certain extent, but also protects dapat yung interest ng kliyente. But with informed consent, nile-level natin with the client or with the patient. So nagiging partners tayo in health, no? Side by side tayo with the patient. Hindi tayo angat sa pasyente na tayo magdidikta kung anong dapat nilang ano yung para sa kanila. mas alam nila kung ano yung para sa kanila. Le-level lang tayo kasi ilalapag natin sa discussion yung mga potential risk at yung mga potential risks ng mga choices nila in terms of their gender affirmation or yung mga health interventions, no? And if possible, how can that be worked around? So hindi tayo simple, oy, mataas yung risk niyan. No. Eh paano kung gustong-gusto niya? Aware naman siya dun sa risk. So dun tayo ngayon, we have to come up with other alternatives to work around with the risk, no? Or at least mag-risk reduction tayo. Okay? Yan. And of course, in transgender health, laging gender-affirming approach. Ang daling sabihin ng gender-affirming approach. Paano nga ba ako magiging gender-affirming sa aking pakikitungo sa aking mga pasyente or kliyente? Okay? So tayo as primary care providers, ang role natin in terms of transgender health is basically to understand and explore issues of gender identity. We have to conduct our initial assessment. So like kunyari, may medical comorbidities ba siya? Ano yung kanyang psychosocial health status, no? Family history as well. Okay? Yeah. Then we have to make appropriate referrals kung hindi man tayo expert. Okay? Ako mismo, I still don't see myself as an expert. Kasi one, I'm a general practitioner, I'm a general physician. I did not undergo endocrinology training, no, or yung residency training and then fellowship. However, I make, considering yung ganong level of training ko, I do make necessary referrals, lalo na kapag complicated yung cases. But as a primary care provider, I am able to provide yung basic medical needs man lang nila. Okay? So as care providers, we have to discuss yung pros and cons of the various medical and surgical interventions na gusto nilang i-undergo. Okay? And then, of course, kung meron silang ginagamit ng hormones, we have to manage both transition-related and routine health issues. So, maliban dun sa impact or effects ng hormone therapy nila or even ng surgery, we also have to monitor yung kanilang, let's say, for hypertension, diabetes. So, yung overall health talaga siya. Basically, very primary care. No? And then we have to provide preventative care appropriate and tailored to the individual. Okay? So very tailored fit ang approach with transgender health. Okay? So for a transgender person, they usually undergo a process by which they affirm or paano ba nila gustong ma-recognize, no? So by their gender identity. So gender affirmation or yung mas naririnig natin sa tawag na transitioning, no? Basically is the overall process. It usually starts on a psychological level, so internalize siya. And then personal or social level na siya kapag nagde-declare na siya ng, ito yung aking chosen name. I prefer to be called Migs, no? Or I prefer to be called Victoria. Yan. And then yung pronouns, so yung iba comfortable to be called with their yung pronouns pa rin ng kanilang biological sex or assigned sex at birth. Pero yung iba, ina-assert na yung, I prefer to be called a certain pronoun like he, him, she, her. Yung iba, they, their. No? Yan. And then, yung iba or karamihan, they pursue yung medical transitioning nga. No? Or yung gender affirmation such as hormone therapy and gender-affirming surgeries. And then lastly, or yung pinaka-challenging is yung legal gender affirmation, wherein nagagawa ng legally i-acknowledge na yung kanilang chosen name and even yung kanilang gender marker. So usually sa passport ito. Yung sa birth certificate, hindi yan mababago. No? Biological marker kasi siya. But yung sa mga passports, since ang nakalagay doon is gender. No? Kung babasahin yung mga passports natin. Yon usually ang napapalitan. And then yung mga other government IDs. Usually ito sa ibang bansa ito. But sa atin, hindi pa. Okay? So, how can I deliver a gender-affirming health service? Okay? So, una-una, kailangan trans-affirmative. So, lalo na kung tayo ay nakaka-encounter ng mga people with diverse SOGSC. Okay? Such as mga transgender nga. Okay? So, paano masasabing trans-affirmative ka? Basically, you practice actively listening to, learning about, and meeting the needs of the trans people using or availing your service. Okay? So basically, practicing unconditional positive regard for our clients. Okay? All gender-affirming care must be inclusive, kasama yung kliyente sa pagde-decide, self-determined. So again, galing kay client yung mga desisyon, and rights-based. So naka-emphasize yung rights-based, no? So kailangan ethical yung practice pa rin natin. So yung karapatang pantao ng ating kliyente dapat ma-uphold pa din. Okay? Ayan. So maliban sa pagiging trans-affirmative, paano ako magiging trans-competent healthcare provider? So, ano ba yung mga competency na kailangan ko? Karamihan ang iniisip mag-undergo nga ng mga fellowship, trainings. No? Ideally naman talaga. No? But maliban kasi doon, a person has to develop yung kanyang trans-cultural competency. This is actually the ability to communicate, understand, and effectively interact with trans people in a respectful and non-judgmental, compassionate manner. Basically, free of stigma and discrimination pag nakikipag-usap or nakikitungo. Okay? So that's for transcultural competency. Paano yan nade-develop? Basically, by meeting people. So by having yung continuous interaction with the community, mas made-develop ito. No? So I don't expect people to have a perfect or to have a top-notch agad yung kanyang transcultural competency. No? Kahit ako na nag-start ako, meron pa ako mga certain biases. So, but with continuous interaction with the community, na-develop ko yung aking lens or lumalawak yung aking pagtingin, no? Sa iba't ibang issue ng buhay ng isang transgender person. So that way, na-develop yung transcultural competency. Aside from that, syempre, as medical providers, kailangan meron tayong trans clinical competency. Ayan. So, dito na papasok yung mga medical training. No? So, basically, this demonstrates yung ating competency in providing or ang application ng ating medical knowledge in terms of healthcare for trans people. Maraming nag-iisip, no? May special training ba for trans health? I cannot say na special, but basically ano lang to, we have to review back yung we have to review yung ating mga basic medical knowledge, no? But we'll just have to tweak it na addresses yung needs, medical needs ng ating transgender clients. Okay? Yeah. So kailangan parehong may competency for both, okay? Transcultural and transclinical to be a trans-competent healthcare provider. Okay? So basically providing healthcare services to trans people free of stigma and discrimination. Okay? So, may kakaiba ba with regards sa transgender health, lalo na sa medical history taking? So, for medical providers, same pa rin naman yung ating history taking. No? Kapag naka-encounter tayo ng patients, we ask certain questions. Ano po yung sadya natin? Kailan pa nag-start ito? Yung mga ganyan. No? So, yung chief complaint, history of present illness, ano pa? ROS, medical history, past surgical, personal, and yung mga social history. Same pa rin to for transgender people. Pero may tinitweak tayo. So, one, we explore yung kanilang gender identity. So, as a healthcare provider, we can simply, ito yung mga guide questions na we can ask. How to probe further sa kanilang SOGSC. No? Sa clinic ko kasi madali na to kasi meron na akong yung how they fill up the form, they simply put in the, may choice sila na ilagay kung ano yung kanilang gender identity. So, minsan yung iba, very aware, sinusulat na nila transgender woman, trans masculine, heterosexual male, mga ganun. May kanya-kanya pa sila. So, ako inaalaw ko sila to freely write there yung identity nila. Pero for us, kung first time natin maka-encounter, these are guide questions naman. How to probe their gender identity in a non-discriminatory and also in a way to facilitate yung openness nila. Okay? So yung structure ng questions, there are gender neutral. Okay? Ayan. So aside from their gender identity, we can also probe regarding their gender expression. Okay? Yeah. So these are also guide questions that you can use. Okay? And then of course, for gender dysphoria or to assess yung kanilang psychological status, no? Kasi syempre for transgender people, they are subjected to a higher level of minority stress, no? So yung pagkakaroon ng kakaibang gender identity pa lang, they're already subjected to stigma, discrimination, which would perpetuate yung feelings of stress, no? Anxiety, and it can aggravate depression. So stress, anxiety, depression would further push a person to suicidality. So these are basically kailangan natin ina-assess lagi yung mental health ng isang trans person. So these are questions that you can freely ask, no? Syempre, once ma-establish nyo rin yung rapport, no? Sa case ko, hindi ko na masyadong tinatanong itong mga to kasi parang yun na, since trans-specific yung service ko, sila na yung nag-open up. Usually, ang opening line ko lang is, so ano pong sadya natin today? Or ano yung gusto mong ma-achieve sa paggamit ng hormones? Then sila na yung magkukwento ng kanilang talambuhay. So isang question lang ako and then 15 to 30 minutes sila na lahat yung nag-open up. So basically, more of counseling pa rin tong gender history talaga. No? So more of we probe, we ask open-ended questions para sila yung mag-open up. Okay? That way, mas hinahayaan natin sila maging komportable, no? Sa sarili nila, sa setting na ating healthcare. No? So mas comfortable sila mag-open up, mas makukuha natin yung mga information na kailangan natin. Okay? And of course, syempre hindi mawawala yung sexual history. So dito tinatanong ko rin outright yung sexual orientation. So kung kanino nagkakagusto, babae, nagkakagusto rin ba sa lalaki, or may iba pa siyang nagugustuhan. Okay? Yan. So yung relationship status, kung monogamous, open relationships, polyamory, yan. All of these terms you will be further discussed during SOGSC sensitivity or yung sensitization. So we also provide training for that. So usually kasi inaabot po yan ng mga hours. Yan. So usually 2 days po talaga yung mga transgender health training natin or workshops. No? Kasi we have to tackle talaga SOGSC and other sensitivities before we can roll out a transgender health. But ito for healthcare providers, it's safe to ask na itong mga bagay na to. Okay? Ayan. And also, we have to ask kung meron silang gender disclosure with their partners. Kasi may karamihan din ng mga transgender people, they are trying to achieve yung passability or yung passable sila. Meaning, hindi sila na yung kumbaga papasa sila as the gender that they identify with. Okay? So kaya nga sila nag-undergo ng mga medical procedures na ito kasi gusto nilang pumasa. No? So yung iba hindi nagdi-disclose sa partners nila. So kaya we have to ask yung level of disclosure. Kasi baka mamaya lumapit sa atin kasama yung partner. We don't want to, parang hindi natin sila ilalaglag. No? So we uphold pa rin yung kanyang privacy and confidentiality, of course. Okay? Ayan. And then we also have to probe, impact of sexual abuse and violence, especially mga gender-based violence. So mas mataas among transgender people yung gender-based violence. It can be as simple as yung tipong kinakantsawan na gagawin kitang tunay na lalaki or gagawin kitang tunay na babae. So yung mga hipo or even worst case scenario na rape, no, sexual assault talaga. And then yung iba, physical abuse talaga. Like yung madalas na naririnig naman natin sa mga balita ito. So worst case scenario nga is death, no? Or so we'll have to probe this kasi syempre iba yung trauma and how to approach that. Okay? So we have to be able to provide or at least refer them to psychosocial support. Okay? With regards naman to medical and surgical history taking, we have to provide care based on the anatomy that is present. So, hindi naman lahat ng transgender person would undergo surgery. So, ang ginagawa lang natin dito, basically we take into account or we create a anatomical census kung tawagin, no? Kung ano pa yung mga anong mga body parts pa yung taglay niya, or if nag-undergo siya ng surgery, what surgeries ito. Okay? For those na nag-undergo na ng very elaborate na yung kanilang gender affirmation, no? May iba sa kanila, hindi sila nagdi-disclose that they've undergone gender affirmation procedures, no? So, again, depende to sa level of their comfort or sa trust na na-build na between the provider and the patient. Madaling nag-open up sila. Pero yung iba nga, ayaw nilang ma-invalidate yung kanilang identity just because na-mention na I've undergone gender-affirming surgery. Okay? So, kailangan may sensitivity with tackling medical and surgical history, especially for trans people who've undergone these procedures. Yeah. So, in terms of health and physical examinations, so kung sa kadalasan in practice, no, we require physical examination. Pagdating sa transgender people, since mataas nga yung chances na one, yung kanilang gender distress or gender dysphoria is nanggagaling mismo sa sexual characteristics that they were born with. Two is they've already experienced sexual abuse or even assault. So kailangan when we conduct physical examination, it has to be trauma-informed. No? Lalo na kapag kahit simpleng chest or yung top examination, we have to be sensitive enough, no? And we only perform these physical examinations, lalo na genital exam, only when necessary. Okay? So, pag sinabing trauma-informed, we always explain step by step yung gagawin and yung purpose of the physical exam. Okay, so sa simula pa lang nilalatag natin yung buong physical examination. May hahawakan ba? Ano yung titingnan? May kakapain? Saang parte? Okay, yan. And then of course, we allow the patients to keep as much as clothing as possible. So kunyari, kahit kailangan ko mag-chest exam, sabi niya, Doc, may bukol ako sa may kilikili. Hindi ko siya kailangan paghubarin ng hat. So as much as possible, may gown. So usually mga hospitals may mga patient gown. So we can let them borrow that, and then kung ano lang yung part na i-examinan, yun lang yung i-reveal. So one at a time. So kunyari, kailangan mag-examine ng breast, we'll have to inform them. And then we'll have to ask, would you be comfortable if I conduct a breast exam? So I need to palpate. So kung sabihin niyang yes, then you may proceed. In the middle of the examination, pag sinabi niya I'm no longer comfortable, then you simply stop the physical examination. Okay? So ako, ang ginagawa ko, since medyo iba, no, kailangan ko talaga makapag-physical exam, I explain to them naman. And then I teach them how to conduct self-physical exam. So kung hindi ka comfortable na ma-examine ko today, ito yung gagawin mo pag-uwi mo sa bahay. So minsan binibigyan ko rin sila ng mga YouTube links na pinili ko na hindi naman mahalay tingnan yung physical exam, no? So hindi rin masyado. Kasi yung iba medyo conscious pa din sa nakikitang body part. So I teach them mga self-physical exam, lalo na for mga trans women who have already developed mga breast tissues. And then for trans men, I also teach them to assess yung kanilang genitalia. Okay? And of course, we have to use gender-affirming language throughout the course of the interaction with the patients. No? So ano yung mga gender-affirming language na ito? So one, acknowledging yung pangalan nila, kung ano yung chosen name nila, and ano yung kanilang chosen pronouns. No? Kahit na ang legal name nila is, kunyari ako, legal name ko is Miguel, pero ang dineclare ko is Victoria, you have to keep calling them you have to keep calling me by Victoria. Okay? And then with regards to physical exam or medical history, minsan, yun nga, makikita niyo sa mga pasyente kung gaano sila ka-comfortable with their anatomy. So may iba hindi matawag yung specific anatomical part kung ano talaga siya. For example, sa atin, very comfortable tayo, yung breast, yung penis, prostate, bayag, di ba? Kasi yun naman talaga yung tawag. But some people or most transgender people are not comfortable kasi nga, yun yung source ng kanilang dysphoria. So we can simply mirror or mimic kung anong tawag nila. So kunyari, tawagin niya na, Dok, gusto ko pong patanggal yung aking harap. So pag sinabi ng harap, may idea na ako na, yung tinutukoy mo ba yung... So gagayan ko lang yung iyong harapan. Opo. So, okay. Kunyari sabihin niya, Doc, gusto ko pong magpa-opera sa baba. Alin po sa baba? Yung sa harap or sa likod? Kung sabihin niya sa harap, ano pong nais nilang ma-achieve sa paggawa sa baba? Okay? Or yung iba, kwan. Very common sa Pinoy. Yung kwan, Doc, meron kasi akong kwan sa baba, sa kwan ko. So, yan medyo challenge. So, tinutulungan ko silang himayin kung saan sila comfortable. Okay? Yan. Again, madedevelop yan the more na nakaka-interact tayo ng mga transgender people in our clinic practice. So these are just suggestions on how to converse, no, mga gender-neutral terminologies na you can try using these statements dun sa first column rather than nung nasa far right columns. Okay? Yan. So we avoid yung mga, we try to use mga gender-neutral terms. So kung sa Pilipino, madali, no? Kasi yung siya, sila, ikaw. But in English kasi she, he, no? So mas madali kung Pilipino. No? Yan. Gender-neutral din kasi yung language natin actually. Okay? Yan. And even for their anatomical features, no, or anatomical, sa kanilang anatomy, we can also try using those terms. May mga Filipino versions naman din ito. So, kunyari, for trans men, yung aking harapan or yung aking dibdib, we don't say dede, no? So, yun yung mga suggestions dito. Okay? Medyo challenge yun sa mga internal organs. Okay? And then other terminologies like in terms of yung how they will describe yung kanilang mga nararanasan ng effects ng kanilang hormone therapy. So for example, we don't mention to them or you're having male pattern balding na a trans woman siya. So pwede natin sabihin or you're having hair loss. Okay? So these are mga ano lang naman, how to further improve our sensitivities. Okay? So kahit yung sa menses or yung sa yung regla, may mga trans man hindi comfortable i-mention ang regla. So ako tinatawag ko na lang, nagdurugo po pa rin po ba? Yung kabuuan ng pagdurugo. Okay? So yung iba nasasabi naman, comfortably yung pagdurugo. Okay? Pero yung regla or even yung panty liner or yung feminine wash. So I simply call, gumagamit ka pa ba ng paddy? O kaya, do you still use yung intimate wash instead of feminine wash? Okay? So, ayun. So as I mentioned earlier, no, so we have to address yung anatomy that they possess. So in terms of medical, no, so we have to keep an anatomical census or basically an inventory of their organs. So if they've undergone certain surgeries, nagpatanggal na ba or nagpa-reconstruct ba ng anatomy? Okay? Maliban dun sa mga medical na binabanggit ko, meron ding mga non-medical na gender affirmation na ginagawa si client mismo or yung pasyente. So we have to be aware of this as well kasi alamin natin kung meron itong mga kaakibat na risk or mga may impacto sa kalusugan niya. So for example, yung ginagawa ng ibang trans men na nagbabinding. So binding is by yung magkaroon sila ng flat chest contour. So may kanya-kanya silang paraan. Karamihan may nabibili ng chest binder sa Shopee or sa Lazada. So para lang siyang yung elastic siya. Okay? So nakakahinga siya malaan ng maluwag. Pero dati, nung wala pang mga binders, may iba gumagamit duct tape. So imagine, dina-duct tape yung dibdib. So everyday tatanggalin, kakabit niya yun. So yung adhesives noon can cause mga contact dermatitis. So mare-refer ko pa siya kay Doc Will tuloy. No? So aalamin natin yung mga ginagawa nilang mga gender affirmation just to assess din kung meron tong health impact sa kanila. Okay? So ayun. And also to help them improve yung health practices nila and hygiene as well. Okay? So it's good to know yung mga non-medical gender affirming steps na ginagawa ng ating patients. Okay? When it comes to transgender health, ideally, or according sa WPAT, it's a multidisciplinary approach. However, binago ko siya kasi the way I see trans health, it's supposed to be interdisciplinary. When we say multidisciplinary kasi, oo, may iba't ibang specialties, specializations, may endocrinologists, may OB, pero may kanya-kanya silang management. But with interdisciplinary, they work as a team. So, hindi yung, kunyari, ako yung endo, or refer to OB, bahala siya kung anong gagawin mo dyan. Sa akin, hormones lang. Kasi OB, basta akin yung pagbubuntis nito. So, hindi siya gano'n. Hindi multidisciplinary lang. So, kailangan interdisciplinary. So, ito usually yung mga health services na hinahanap ng mga transgender people. No? So, hormone therapy. Kailangan ba endocrinologists? Ideally, endocrinologists. No? Kahit ako noong unang beses kong maka-encounter ng transgender health, no? Ang una kong naisip pag-usaping hormones, sinong expert? Endocrinologist. However, aware naman tayo na even transgender health, hindi pa siya part ng medical curriculum ng panahon ko. For residency training, for internists, wala rin siya. For fellowship ng endocrinologist, wala rin siya. Okay? So, unless merong particular interest ang isang healthcare provider, saka lang na-access yung mga trainings for this. Okay? So, anyone na competent or any physician na competent with hormone prescription, pwede. So, papasok dyan, FAMMed, general practitioners, even cardiologists. So, yung mga una ko nakilalang transgender health provider are actually cardiologists, gynecologists. Meron ako mga nakilala ring endocrinologists, pero mas nauna pa yung mga cardio. So, yun. Aside from hormone therapy, yung may mga transgender din tayo nag-aasam na maging tatay, nanay. So, papasok din dito yung reproductive health. So, this is a team of endocrinologists, obstetrician, and fertility specialists kung kinakailangan. Okay? And then, of course, yung sa boses, voice and communication. So, yung mga trans man nga gusto mas malalim yung boses. And then, yung mga trans women, gusto nila mas manipis yung kanilang boses. So, hindi na-address ng hormone therapy lahat. Yung iba, kailangan through training. No? So, may pumapasok dyan mga speech therapists. And then, yung kung talagang surgical, pwede rin with the help of the ENT, head and neck surgeons. Okay? So, vocal cord surgery na siya. Okay? And then, mga gender-affirming surgeries as well. Ito ang may kailangan ng mental health professional. And then yung hormone prescriptions pa din will have to be continued even after surgeries. And of course, yung specific surgeons. So kunyari, involved na operahan is yung genital. So papasok dito kailangan yung urosurgeons. No? And then of course, yung post-operative care and follow-up. Other needs then in terms of medical transitioning, so yung lifelong, preventive, and primary care. So ako mostly ito, primary care service ang aking handle. And then yung cancer screening din as well. And then especially for those na undergo na ng bottom surgeries, no, or urogenital care pa din. And then special groups, ito namang special groups definitely would warrant referral or management with pediatric endocrinologists and adolescent psychiatrists or psychologists. So, special group sila kasi yung ganitong age group, volatile pa yung kanilang cognitive development and as well yung kanilang psychosocial maturity. No? So, volatile yung term, no? Kasi nga very subject pa to influence and of course, marami pang binabantayan sa kanila in terms of their cognitive developments as well. So kaya kailangan supervise talaga ito ng pediatric endocrinologist. Okay? And then of course, people with disorders of sex development. Pasok dito yung mga intersex and then yung mga, let's say yung mga, may mga Mullerian agenesis, congenital adrenal hyperplasia, etc. Bakit sila kasama dito? Kasi definitely they have to be counseled kasi iba yung posibleng iba yung kinalakihan nilang gender dahil sa kung ano yung na-label sa kanila. So, pero yung anatomy na taglay nila says differently. So, papasok doon yung counseling pa din. And then they get to choose, lalo na for intersex, no? They get to choose ano ba yung identity talaga na gusto nilang i-pursue. And then of course, mga surgeons, gender-affirming surgery, we no longer call it sex reassignment surgery. So wala namang nire-reassign sa kanila. But we provide the surgery for them to further affirm yung gender identity nila. So I categorize or I usually group them into 3. So head and neck. Kasama na dyan yung mga rhinoplasty, yung thyrochondroplasty, yung sinashave yung Adam's apple for trans women. Yung iba naman nagpapatabas ng mga chin or nagpapalagay ng double chin kasi how they perceive kung ano yung kung ano yung masculine or feminine for them. Okay? And then for top surgery, anything above the waist. So usually ito yung breast augmentation for trans women and chest reconstruction for trans men. Okay? And then bottom surgeries, anything below the waist. Kasama dito yung sa external and internal organs. So for trans women, marami yan. As simple as orchiectomy, kasama dyan. Or kung yung elaborate na is yung full genital reconstruction. And for trans men din as well, meron yung mga phalloplasty. May iba naman as simple as gusto lang ipatanggal yung mattress. No? So hysterectomy with or without oophorectomy. So it varies. Surgeries will depend on ano yung goal ng client, ano yung end na gusto niyang ma-achieve, whether anong purpose ano yung gusto niyang ma-achieve na function, no? Kung magagamit niya na gusto kong makaihi ng makatayo or gusto ko pong makipag-sex with my partner using yung anatomy na with the surgery na gagawin natin. Yeah. So ganun ka-specific yung kanilang goals, no? So not just yung aesthetics ito, but yung functionality din nila. Okay? Yeah. And then, yes, may psychotherapy, but hindi siya to psychotherapize yung transgender, to convert them back or magbalik loob. So that is very unethical, no? That's no longer considered as an ethical practice. Psychotherapy is provided to help them explore their gender identity, role, and expression to address the negative impact of gender dysphoria and stigma. So kunyari, yun nga, meron silang mga general anxiety disorder, na-develop sila ng mood disturbances or even yung mga depression, or lalo na kung may suicidality siya, dito papasok yung mga psychotherapy. No? Yeah. And of course, it helps alleviate internalized transphobia. So you'd be surprised, maraming part of the community na sila mismo meron silang internalized phobia. Okay? And then, purpose of psychotherapy is to enhance as well yung social and peer support. So hindi lang yung pasyente natin ang involved sa psychotherapy. We extend it to kung may partner siya, kung sa family niya, or kung group, let's say mga friends, peers, or if in a workplace, so may mga, kunyari sa school, yung guidance counselor, kung sa work, yung sa HR, no? And then we also use psychotherapy to help them have a better perception of body image. Kasi nga, dahil din dun sa pressure na kailangan maging passable, they will undergo certain extreme measures na ma-achieve yung sexual characteristics of their gender identity. Na yung iba, dito pumapasok yung question ko lagi, how would they define na ganap ng babae or ganap na lalaki na sila? So, ano ba yung sukatan ng pagkalalaki or pagkababae. So yung iba kasi mako-consider ko ng babae ako kapag magandang-maganda na ako. But again, beauty is in the eye of the beholder. So yung iba, ang definition ng maganda is gano'ng katangos ang ilong, gano'ng ka-narrow ng chin, gano'ng kalaki yung boobs. So dito papasok yung psychotherapy na perhaps we can help them have a better perception of body image. And of course, purpose din ng psychotherapy is to promote resilience dahil we cannot eliminate yung stigma and discrimination. One way or the other, we will still encounter this, but we have to improve yung ating coping mechanisms and therefore promoting yung resilience. No? Yeah. Then kung sa team nyo, meron kayong mga social worker, no? We can further, or mga peer counselors, no? Such as yung mga other communities or transgender people. Dito nyo sila pwedeng ipasok. No? So we can provide peer support resources, whether sasali sila sa isang group or meron ding mga online support, mga threads or mga forums, no? That they can also access, yan, not just for the clients or patients, but also for their families and friends. Okay? Yeah. Okay. I think papunta na tayo sa exciting na part. Time check lang. Okay. Okay. Sige, bilisan ko na ito. Okay. So, I think the slides naman will be provided by the team, no? So yung iba dito, I'll be skipping, but I'll just be focusing on key messages na lang. So with regards to hormone therapy, I don't expect everyone after this training to be prescribing na agad. Okay, but you have to be aware na ang objectives of hormone therapy is to ensure na medically appropriate yung hormone level for their gender affirmation. And we have to prescribe accurate hormone regimens. Okay? So paano natin gagawin yung mga yan? We have to establish first that yung client goals. So we don't need to diagnose them with gender dysphoria for them to access hormone therapy. So hindi na. Hindi required or hindi mandatory na mag-undergo ng psych evaluation prior hormone therapy. But we need to we have to be clear kung ano yung goals ni client, kung bakit niya gustong mag-hormones, ano yung gusto niyang ma-achieve. Okay? At kung sa hormones niya ba, makukuha yun. Okay? Yan. We have to evaluate their medical conditions na maaari ma-exacerbate or ma-aggravate ng paggamit ng hormones. So either dahil na-deplete yung kanyang endogenous hormones or dahil dun sa pinasok natin exogenous hormones. Okay? And then of course, we have to have monitoring. So dapat na monitor yung hormone levels niya. Okay? So pwede, karamihan ng endocrinologists mahilig mag-baseline. Ideally talaga, may baseline. Okay? So para rin makita natin how much yung nag-develop or nag-improve after employing yung hormone therapy. Yeah. So consideration sa pagpili ng hormone therapy, number one, kailangan may effect ba? Nakukuha ba nung patient yung target features niya through this regimen. And of course, kailangan natin i-ensure yung safety niya at yung side effect profile niya is tolerable for the patient. So in terms of side effects, maliban sa intended side effect ng hormones, meron silang matatanggap na mga gender-affirming effects na hindi nila gusto. Like, kunya for trans men, ayaw nilang makalbo. Pero kasama kasi yun sa effect ng testosterone or ng masculinizing therapy. No, magbabago yung hair patterns nila. Okay? And then, of course, accessibility. Kasama dito is mabibili ba to sa butika? Magkano siya? Afford ko ba? Okay? So for the gut effects or gender-affirming hormone effects, so yung for the feminizing, basically, ayan. And then for masculinizing therapy, ito naman. So basically, magbibinata for trans men, magdadalaga for trans women. Lalo na kung lumagpas na sila sa kanilang puberty or sa kanilang adolescent stage. Okay? Yeah. For trans women, ang paggamit naman ng hormone therapy is basically to reduce yung male characteristics. So paano gagawin yun? Tinataas natin yung estrogen level sa katawan nila by nagpapasok tayo ng exogenous estrogen. And then of course, gusto natin mas maging pronounced yung kanilang feminine appearance. No? So yun nga, tataas yung estrogen and then we can use androgen blockers to decrease yung testosterone. Okay. There are certain guidelines naman in place. So from the US, European, and yung sa world associations, no? Meron nga lang silang iba-ibang recommendations. Usually nagkakasundo yung Europeans at saka yung WPAC. But for the US, no, this one is from University of California sa San Francisco. They do not recommend anti-androgens, unlike with the Europeans and WPAC. And however, they do recommend progesterones, but for the other societies, they do not. Okay. Yeah. Pero ang definitely ang mainstay treatment for GAT for trans women is estrogen. So for us, healthcare providers, kung maka-encounter tayo ng patient who mention na gumagamit siya ng hormone therapy, ito yung mga hahanapin natin sa kanila or we have to assess them for this. Okay? So they're at high risk for thromboembolic disease, lalo na kapag mali yung or masyado mataas yung dosing or masyado na rin silang matagal gumagamit ng hormone therapy. Moderate risk naman for these conditions. No? So again, karamihan is cardiometabolic disorders. Okay? So in terms of monitoring for trans women, kung titingnan nyo, in terms of HIV primary care, yung iba dito minomonitor na talaga natin. Madadagdag lang is yung hormone level monitoring. Estradiol, testosterone. Okay? In terms of follow-ups, ideally 3 months for every 3 months in the first year and then at least once or twice a year thereafter. Okay? Yung measurement ng testosterone and estradiol, ito yung ideal, however, costly. So ako at least man lang every 6 months nakakapag-measure or depende kung may changes dun sa dosing. Yeah. Routine screening for cancer is recommended. Similar lang din with non-transgender women or cisgender women. Okay? Yeah. Then yung bone marrow, for the bone mineral density profiling, no? So, kasi kung at risk for osteoporosis, lalo na yung for those na nag-undergo ng orchiectomy, so this has to be conducted as early as 60. Pero may iba nga maaga nag-orchiectomy kasi hindi naman nag-hormone therapy. You have to screen them for osteoporosis. Then you have to provide sex hormones pa din to prevent osteoporosis for those na nag-undergo ng orchiectomy. For trans men, yan. So to prevent yung female sexual characteristics, basically will have just they have to be given exogenous testosterone. Okay? Wala naman tayong blockers for estrogen. Okay? Yan. And these are the medical risks that are associated with masculinizing therapy. So lahat ng trans man, makikita nyo talaga na gumagamit ng hormone therapy, may erythrocytosis. Okay? Yan. Kahit low dose yan, magkakaroon talaga sila niyan. Okay? And then moderate risk for adverse outcomes. Ayan, cardiometabolic pa din. Ayan. And then in terms of monitoring, almost similar with trans women. Okay? Pero mas maigting tayo nag-monitor for CBC. Okay? Monitoring, similar lang din. But yung hematocrit and hemoglobin, ayan. Ito talaga, mahigpit to. For the first year, kailangan talaga closely monitored to. Kasi yung iba biglang sumisipa ng 20 RBC. So pag gano'n, mag-adjust ng dose. Okay? Ayan. Or i-refer nyo na to someone to address that. Okay? Ayan. Yeah. So for those na nag-undergo ng ovarectomy or tinanggal yung ovaries, they have to continue taking testosterone therapy, no, to prevent yung osteoporosis. Yan. Okay. So in summary, ganito lang talaga yung ginagawa with trans health, no? Yan. So kasama yung sexual health, we assess for STIs. So sa atin baliktad, no? So more of STI yung initial approach, then magkakataon transgender itong patient natin, then we have to engage as well with transgender health. Okay? Kasi studies also show, no, na mas mataas yung retention in HIV primary care kapag ang isang transgender person is also accessing transgender health needs. Okay? Yan. Sige, so balikan natin yung case natin kanina. So si Victoria nga nagpunta sa atin for nausea and dizziness. However, naungkat natin na she's already been on diagnosed for, she's been living with HIV for the past 5 years na and she's on Lamizydo efavirenz. Okay? So ang complaint niya, ang concern niya is lagi siya nahihilo, naduduwal. Every time siya, gumagamit siya ng ART niya, which are known side effects naman ng gamot niya. No? And then yung napansin niya, mostly onset ng dizziness is 2 hours of within the 2 hours of taking efavirenz. Hindi masyadong nare-relieve kahit gumagamit siya ng mga antacids. Okay? So, naungkat natin sa past medical niya na yung gut niya or hormones na ginagamit niya for feminizing therapy niya is 6 years na. So, mas nauna na siyang gumamit ng feminizing hormones. Okay? And inconsistent siya. So, salit-salit, whether oral or injectable. Okay? Yan. In terms of personal history naman, yun nga, she's already having hard time concentrating at work dahil dun sa mga side effects na nararanasan niya. Okay? And then in terms of physical exam, we can conduct a trauma-informed consent. Conduct a trauma approach, no, yung sa physical exam. Okay. So tayo as primary care providers, especially in the HIV setting, ito yung mga nais natin i-check, no, or at least man lang ma-review yung kanyang baseline or yung recent CD4 counts niya, baseline or previous viral loads niya, and then of course, latest CBC, yung kung meron na siyang recent na metabolic and renal panel, so yung mga lipid profile, kidney function, yan. And of course, uungkatin talaga natin ano yung current na ginagamit niyang hormone therapy. Mainam na malaman natin kung naka-oral tablets siya or injectable. So I'll discuss further later. Okay? And of course, yung sa paggamit ba niya ng hormone regimen niya is kung overdosing siya, and kung na-achieve na ba yung mga effects nito. Okay? And kung may plans na for surgery. Kasi baka mamaya naman, may plans for surgery, then baka pwede natin ibaba na yung mga yung hormones na tinitake niya. Okay? So dito pumapasok yung vital statistics. Aside from vital signs, we also monitor yung vital statistics kasi body weight, bust line, and then waistline as well. Lalo na for trans women na magsa-start pa lang mag-hormone therapy, I ask them to measure their bust line para na-appreciate nila yung development. Okay? So for our client, HIV-1, we have to rule out first virologic failure, and then yung mga effects na yung complaint nga niya is mostly related dun sa adverse effect ng antiretroviral. So definitely we'll have to check for viral load. Okay? So kung ano naman, undetectable siya, walang problem. Pero kung magkataong mataas yung kanyang viral load, proceed with genotyping before we can consider shifting yung regimen. Okay? So for hormone therapy and ARTs, ito na yung exciting na part. Okay? So before, kahit nung nag-start ako with transgender health and HIV primary care, very limited pa yung data regarding sa drug-drug interactions between ART and feminizing hormone therapy. Okay? So dati, usong-uso pa yung, ay, pinapahinto natin yung ating clients with hormone therapy just to start ART. Pero nagiging dahilan yon kung bakit hindi nag-proceed for HIV treatment yung transgender person. Kasi they would rather maintain yung hormone therapy kesa mag-ART. Okay? Kasi for them, that's life. Yun yung buhay. Mas buhay sila doon. No? Di bali nang may sakit, basta maganda pa rin. No? May ganun akong natanggap na patient. So, wag nating ipahinto yung hormone therapy kung sakaling nauna silang nag-hormones bago tayo mag-initiate ng ART. So, may mga recent updates naman or researches na lumalabas na. Okay? So, in terms of hormones and HIV, yeah, interactions can be present. No? So, mainam na updated tayo lagi dun sa mga drug-drug interactions. So, mostly, ang first line or ang recommended na regimen is dolutegravir base for trans women on oral estrogen therapy. Okay? May nag-question kanina, ano yung nagpapababa or nagpapataas yata ng estrogen and ART. So, tenofovir has been seen to be decreased in trans women, no, taking oral hormone therapy. However, yung clinical significance nito is still yet to be determined. So, kung ito ba ay nakakataas ba ng viral load, nagkakause ba siya ng virologic failure? Hindi naman exactly. Kasi virologically suppressed naman so far yung mga clients na minonitor nila. And then, efavirenz and nevirapine can actually lower plasma estrogen concentrations. No? So, wala akong nakitang hormone therapy, wala akong nakitang ART na nagpapataas ng estrogen. But may mga ART na nagpapababa ng estrogen levels, okay, such as nevirapine and efavirenz. And then, rilpivirine has more favorable drug interaction profile with hormone therapy. In terms of PIs naman and pharmacologic enhancers, ritonavir and cobicistat, hindi naman masyadong common ang cobicistat sa Pilipinas. But these are known to have interactions with estrogen through both induction and inhibition of the cytochrome P450. Okay? So yung regarding sa mga nag-ART na nagde-develop ng gynecomastia kahit hindi sila trans women, no? So, paano nangyayari yun? So, ang mga mechanisms nito are still to be not fully understood, but isa doon is yung sa fat metabolism, nagbabago nga, no, with, especially with efavirenz space. And then yung peripheral estrogens kasi, mas nagiging sensitive yung mga due to the improvement of T cells, mas nag-i-improve din yung estrogen sa peripheral receptors. So, mas nagde-develop ngayon sila ng gynecomastia. Hindi tumataas yung estrogen. Mas nagiging mas nagkakaroon ng interaction yung estrogen with their respective receptors. So, mas nagde-develop siya ngayon ng gynecomastia. And then, some of the ART regimens are actually causing decrease in testosterone. So, nagkakaroon ng secondary hypogonadism for cisgender men. No? But for hormone therapy and ARTs, ito yung mga nakitang drug-drug interactions. Okay? So, kailangan ko bang pahintuin yung aking patient na nag-hormone therapy just to start HIV treatment? No. You just have to make sure piliin maigi yung regimen for them. Okay? And alamin din kung ano yung regimen na ginagamit nila. Kung injectable ito, so some recommendations, mas mainam na naka-injectable sila rather than oral estrogen. Kasi yun nga, nag-aagawan kasi pag oral lalo na sa liver metabolism. But kung injectable ito, it bypasses the liver. So, hindi masyado maaapektuhan ng ARTs, yung kanilang hormones. Okay. Yan. So, for this patient, so again, pag nag-shift tayo ng ART, kailangan guided by genotyping kung drug resistant. Kung hindi naman, kung virally suppressed siya, then we can proceed with shifting. Then we shifted this client to dolutegravir. Then of course, yung appropriate follow-ups. Yeah. For non-PHID clients, so syempre maka-encounter din tayo nagpapatesting. Tapos nalaman natin, transgender, on hormone therapy. Doc, pwede po ba akong mag-PrEP? Yes. No? So based on sa IFAC study na ginawa sa Thailand, they discovered nga na merong 12% reduction in tenofovir when they are also using feminizing hormones. However, yung clinical significance nito, hindi pa na-determine fully. So still, enough pa din naman yung ang concern kasi ng transgender women kung bababa ba yung kanilang estrogen while on PrEP. No? So basically, hindi. As long as naman, and also effective ba yung PrEP sa kanila. So PrEP is effective while on hormone therapy. Ang recommendation nga lang, they have to adhere to a daily PrEP regimen to maintain a highest level of PrEP. Okay? Yeah. So for our patient na transgender, no, we engage in transgender health by providing counseling do sa paggamit nila ng hormones. So kung overdosing sila, we have to taper it down. Or kung di pa sila nagmo-monitor, nag-check, we have to see kung baka naman excess na yung kanilang estrogen or baka naman hindi napapataas yung estrogen kahit na mataas na yung ginagamit nilang dose. So, doon napapasok talaga yung ating management as trans health providers. Okay? Kung hindi pa tayo gamay, hindi pa natin gamay yung trans health, then we have to make the appropriate referral. Yan. But for us, ito na yung mga simple monitoring na magagawa natin on our level. Okay? Yan. I included here, yung mga mga hormones. So nagsiscreen din ako for thyroid kasi karamihan din no, nagde-develop with subclinical hypothyroidism for trans women who are on matagalan ng nag-hormone therapy. And then siningit ko lang yung serum potassium dito in the event na ang gamit ng androgen blocker is yung spironolactone. Okay? Then, upper abdominal ultrasound kasi she's still complaining of kung nagko-complain pa rin siya ng nausea, baka naman nagde-develop, meron na pala siyang gallstones. So, we have to assess them for polylithiasis. And then, for psychosocial, if you have limited time for counseling, you can actually use certain screening tools such as the DAS-21. This basically is a good screening tool for depression, anxiety, and stress. Tatlo agad. No? And then yung PHQ-9, lalo na kapag mataas yung suspicion niya for depression. So ginagamit din natin itong mga tools na to see kung nag-i-improve ba yung kanilang mental status with the hormone therapy and even with HIV treatment. So kung for every 3 to 6 months, nire-recheck natin itong tools na to at kung nakikita natin doon, nag-i-improve yung sagot nila doon, then at least meron tayong documentation. No? Sa kanilang psychosocial status. Yeah. And then of course, papasok pa rin cardiovascular health, bone health screenings, and cancer screening for this patient, especially for those na naka-ART. So, my key messages, basically, ngayon pa lang magkasundo na tayo about SOGSC. No? Gender diversity is not a pathology, and healthcare must be accessible to all, regardless of their gender. Okay? And we have to be inclusive, human rights-based ang ating approach. Kung hindi pa tayo ang mismong trans health provider, we can be allies by learning more about trans health needs. And as much as possible, we help alleviate not aggravate gender dysphoria. So with that, I end my lecture. For more information, you can visit us at our webpage. And if you want po yung mga transgender health training or workshop, sensitivity training, we also provide that under our trans program, which is Transcend. Okay, so feel free to send your inquiries po.